In a hypothesis test, we will encounter type 1 and type 2 errors. The state of nature is that the null hypothesis is true or the null hypothesis is false. Remember that the null hypothesis is the statement of indifference. We first assume that the null hypothesis is true, then we seek evidence to either reject or fail to reject the null hypothesis. And so the decision in a hypothesis test is whether we would reject the null hypothesis or we fail to reject the null hypothesis. Obviously, we do not know the true nature, the state of nature. And so, if the null hypothesis is false and we reject it, then we make the correct decision. If the null hypothesis is true and we fail to reject it, then we also make the correct decision. However, if the null hypothesis is true but we reject it, then we commit a type 1 error. And if the null hypothesis is false and we fail to reject it, then we commit a type 2 error. A classic example of the consequence of our decision is in medical experiment. If the drug is effective, and we don't know whether it is effective or not, but the company rejects it, then they commit a type 1 error. What is the consequence? Is that that drug can be helping a lot of people, but they reject it, meaning that it will not go into production. People will not be able to take that medicine. And that again is a type 1 error. For the type 2 error, if the medication is not effective but somehow they accidentally failed to reject the null hypothesis, meaning that drug is not working, but they approved it because they failed to reject it. What is the consequence? Well, not only that drug is not helping, it costs people a lot of money, and not to mention that they might develop some other side effects. And that is the type of errors that we would need to keep in mind when we are serious about hypothesis testing.